So hello, everyone. Welcome to Promoting CHW Self-Care, Prioritizing CHWs while taking care of the community. Courtney, can I have you go to the next slide? So before we begin, in this meeting, we will have simultaneous Spanish interpretation. As a participant, you will have to choose a language, either English or Spanish, to listen in Zoom. If you do not choose a language, you will not be able to hear the presentation. So on the bottom of your screen, you will see a button that says interpretation. Please click on that and then select the language that you would like to hear. Next slide, please. So the Zoom webinar will have automated closed captioning. So closed captioning could be turned on or off throughout the meeting today. And for the folks who are using laptops or computers, on the bottom of your Zoom screen, there is a button that says live transcript. Please click on that and then select show subtitles in order to see closed captioning. And then for the folks who are on mobile devices, please go into your meeting settings and then turn on closed captioning. Oh, okay. So can I go to the next slide? So hello and welcome everyone to Promoting CHW Self-Care, prioritizing CHWs while taking care of the community. The Vision team is excited for today and grateful for the opportunity to once again be in community with you all and share this space and have the opportunity to be working alongside each of you. This month's webinar will be focused on promoting CHW self-care from an individual and systemic perspective. So before we begin, I do want to introduce myself to you all. Hello, my name is Mengshi Kang. I am the new Envision CHW training coordinator. I will be taking over Jamal's role. I've been a CHW for about a little over 2 years now. I came from a small community-based project. We're not even an organization, we're just a project called the Hmong and Hispanic Communication Network from Central Wisconsin. I say, we're a really small project, but I think we made a really big impact with the efforts that we've been doing in Central Wisconsin here. We have a really big Hispanic immigrant community here and a really big Hmong refugee community in Central Wisconsin here. So our goal as the Hmong Hispanic Communication Network, or H2N for short, was to address health equity and health disparities. So that is where I came from and that's my background. So thank you all for joining us today. So while we are on call today, we have a small list of operating agreements to ensure that we could collectively build a welcoming and brave space. Much of today's webinar will be content delivery. So we do ask you all to stay on mute and post questions in the chat box. The chat box will function as your primary point of connection today. We encourage you all to use it frequently and treat the fellow attendees with dignity and respect while doing so. And then we will have a brief Q&A section at the end of today's webinar as well. And then just one last kind reminder to do what you need to do to take care of yourself. So can I go to the next slide? So for today's agenda, we will include Envision News, and then we will go over NACHWA's CHW pay equity. And then we will dive into our primary content, which includes a presentation from 2 presenters on CHW self-care. And then we will have a Q&A section and then wrap it up with our poll. And then I will pass this on to Monique.
Hello, all. I am Monique Allen. I am the new community of practice lead with Envision, and again, a community health worker. I have over 20 years of experience working in the community. I'm also a sign language instructor at Victor Valley College. In my time working in the community, I've been a part of various community coalitions, community projects, and advocacy for the deaf and hard of hearing community, which led me to start my own gym and nonprofit to focus on the deaf and hard of hearing community and the health disparities there to not have access to physical fitness. So just trying to bridge that gap there. Just prior to coming to Envision, I worked with Loma Linda University Health as a CHW peer support specialist, focusing on mental health. So that was a bit about me. Thank you so much for joining us. And now a bit about Envision. So Envision is a collaboration of community health workers and community health worker allies who work together with financial and administrative support from the Centers for Disease Control and Prevention to elevate the role of CHWs. Envision supports those funded by CDC through the Community Health Workers for COVID Response and Resilient Communities Initiative, developed for CHWs by CHWs. The project will encompass the CHW movement as a whole and will train and support CHWs, concentrating on capacity building and the sustainability of a strong, capable CHW workforce. Together, our collective and diverse experience spans several decades and many states, counties, tribes, and territories. The focus on the collaborative efforts is to better equip and enhance the capacity of CHWs to expand the CHW role in COVID education, awareness, and recovery. Train and prepare CHW workforces to respond to future pandemics and/or community emergencies. Sustainability, cultivate healthier, more resilient communities. And now we can move to Envision News. Okay, so what we have coming up, we have our Envision CHW expansion, and that is now, the nominations are in, it is closed, and we are calculating all of that, and we will work on that this month, and the council will be announced beginning of next year. And our Envision website is live. I will drop that in the chat once I am done here. And you guys can feel free to go in there, and it is also here on the slide. But again, I will also drop that in the chat. And upcoming, we are going to have a Spanish community of practice. So if there is anyone interested in that, I will also drop my email in the chat. So if you're interested in a Spanish community of practice and being involved in that, please feel free to contact me. And that is all the Envision news. I will pass it back to Mungshi.
Thank you, Monique. Okay, so today's webinar is focused on promoting CHW self-care and self-compassion. We are aware that pay is a contributing factor into on CHW burnout, which is why this is the perfect opportunity for us to talk about or take a look at NACHWA's CHW pay equity policy and the recommendations to elevate pay equity. So next slide, please. So NACHWA, the National Association of a Community Health Worker, sent out a survey to CHWs throughout the nation. And their goal from this survey was to advance the national professional identity, policy leadership, and organizational capacity of CHWs in the United States. They were able to receive 867 respondents from the survey, and a little over 770 were from English-speaking CHWs, and then about 95 were from Spanish-speaking CHWs. And these respondents, or these survey response, came from over 850 different zip codes throughout the nation. So the focus, NACHWA only asked 3 questions on this survey. And the first question was, what is the current, what is the CHW's current employment status? So whether they are working full-time, part-time, and so on. And then were they receiving pay for overtime work? And then the third question was, what is their perspective on their current pay? So do they believe their current pay is an equitable and livable wage? So why is it important for us to address pay equity? And this is what NACHWA had concluded. And it was to addressing pay equities for CHWs promote our personal and family economic well-being, our retention in the workforce, and is a concrete acknowledgement that we are respected as professionals within the communities where we live and the organizations where we serve. The next slide, please. And so from the results of the questions that they asked, if they believe that that their pay was equitable and a livable wage, 21% of the CHWs that responded said they strongly agreed that their pay is equitable and a livable wage. 25 agreed, 26% remained neutral, 16% said they disagree, and 12% said that they strongly disagree. So after reviewing a lot of the results from this survey, these were some actionable steps that NACHWA had recommended for folks in order to address CHW pay equity. So here are some of the recommendations. CHW's compensation should reflect CHW's lived experience, depth of community knowledge, trust over academic achievement or certification status. CHWs should co-develop employment policies to reflect the work that they do. Payers and funders should require those they fund to pay CHWs a livable wage, a living wage based on their geographic location. And CHW employers should create an overtime bank where CHWs can share time and share time with others who need it. So why is it? How does this tie back into self-care? So first, we must kind of focus on why we are even addressing CHW self-care today. And it's because we understand and we realize that there's been an increase of CHW burnout recently. But as I stated previously, pay is a key component to CHW burnout and affects mental and economic well-being of our CHWs. So if we pay CHWs an equitable wage, we can alleviate additional stress that CHW have from the work that they are doing. So in order to actually really, if we want to promote self-care and self-compassion, CHW self-care and self-compassion, we must also address pay equity as well. And then I will also drop the link to the PDF of the NACHWA CHW pay equity here. So if you want to read and you want to go more in depth with what they found, the PDF will be in the chat box. So with that, it's my pleasure. Are we moving on to the next slide? So yes. So with that, it's my pleasure to transition into the primary content for today's meeting, which is promoting CHW self-care, prioritizing CHW while taking care of the community. This section would be co-led by Yemenet Diaz-Linhart and Erica Guimarães. And Erica is a CHW and is currently the Senior Program Manager at Mass General Brigham in Boston. And she is also part of our Envision CHW Council. Her work revolves around health equity, such as addressing barriers faced by immigrant communities and improving CHW workforce development. Yemenet is an English and Spanish bilingual public health social worker and researcher at MIT. Her research focuses on supporting physical, emotional, and social well-being for frontline workers by considering the impact of worker voice and involvement in organization. She is also a trauma responder for workers and residents of Massachusetts. So next slide.
All right, thank you, Mangshi. Hello, everyone. I'm Erica Guimarães. I've been doing CHW work here in Massachusetts for about 17 years now. I've worked as I'm a certified CHW here, have worked as a CHW supervisor, program manager, worked at the Department of Public Health, supporting other CHW supervisors, providing technical assistance support. And I'm going to draw a lot of my sort of content today from my experience. It's been a pleasure for the past year to serve as a CHW council member with Envision and work alongside other wonderful council members. And today I'm very, very excited to be here with you all. I have known Yaminet, my co-presenter today, for a number of years. We've both done CHW work here in Massachusetts for a number of years, but we have never presented together before. So I have deep respect for Yaminet as a person, human being, and as a professional. So thank you all for having us join you. So our training objectives for today is to describe the unique self-care needs of CHWs, to discuss individual and programmatic strategies to promote CHW well-being, and to provide resources to promote CHW well-being. I'm gonna turn it over to Yaminet, and she's gonna get us started.
Hi, everyone. I'm so happy to be here. My name is Yaminet, or Yaminet in Espanol. And first of all, thank you for everyone who's responded to the question in the chat. I just want to highlight this, I wrote down, I have a little pen and notepad here. So I wrote down that folks are thinking about self-care techniques, wanting some guidance on preventing burnout, thinking about how to practice self-care in terms of time management. And I'm also, there's more stuff in the chat that I can't get to 100%, but I think this is really helpful to know why you all are here today. And we're just so grateful that you're here, and I'm happy to be here. So one of the things that we wanted to address right away is what are the unique needs of CHW well-being. And I have had the pleasure of working with CHWs for a large part of my career, and I come from a family of promotoras. And so I want to share a little bit of information about a research study that I did that looked at community health worker well-being. Next slide. So when we talk about well-being, as you notice, we talked about pay equity, we talk about well-being at these 3 levels. And that's really important because everybody has heard the phrase, put on your oxygen mask before you put on your other, the oxygen mask for somebody else. I have a great colleague, Joanna Bridger, who always kind of deconstructs that, and she'll say, but why are the oxygen masks even, activated to begin with? What is it about the environment that this airplane is in that the oxygen masks have been deployed? And that's a really, really important question, because it's not just about individuals taking care of themselves. Yes, it's part of that. And it's also about where we live, where we work, all the kind of other structures that really impact our well-being. Next slide. So in the research that I did, one of the really surprising findings has been just high levels of burnout. We have, these questionnaires where we measure different types of things like burnout and satisfaction. And burnout, I'm going to give a definition so that, because we're going to be talking about burnout a lot. Burnout is really a result of chronic workplace stress. So it's just too much stress all the time. And it leaves workers feeling just depleted, exhausted, maybe detached, right? Especially for community health workers, where the meaning of work is so important. The mission and the meaning of work is so important. Maybe feeling negative or cynical. And then you just kind of don't feel as effective in your job over time. And so we know burnout can happen across all different types of occupations. What's really interesting is in the research that I've done, that about 40% reported burnout symptoms, like they were really struggling with burnout. And if you just think about 40% is like if you're in a room with 10 people and at least 4 of those people are totally burnt out. That's actually a pretty high number. And then what's really surprising is that 85% of the same people said that they were either very or somewhat satisfied with their job. And so again, I think what's unique about CHWs is the recharge for CHWs is that they love the work that they do. You all love your work. That's why you're community health workers, because you are part of the communities that you work with. And that's really, really unique and important. And I just, it's so important to highlight that. Next slide. So some other interesting information is that CHWs that I worked with are also saying that they're always, often, or sometimes stressed. So they're experiencing lots of stress. And, you know, some of them are thinking about finding a new job. Another interesting aspect is how we orient ourselves to our work. So there's a really interesting questionnaire that says, you know, you think about your work as a job. So think of that like a paycheck, a career, like you're climbing a ladder, or a calling. So it's much deeper than, you know, than a job. It's really about you're meant to do this work. And so CHWs do see their work as either a career or a calling, and not so much as a job. Next slide. How about their health, their well-being? So not only is there high burnout, they're also, you know, experiencing symptoms of depression that would, you know, warrant going to a medical provider for treatment, about 37%. And then on average, CHWs that I worked with reported that there were about 8 days where they said their mental health was not good in the last month. And for this particular, you know, part of the United States, that's actually much higher than average. Next slide. So I just want to think about and really bring the voices of CHWs I worked with, because it's so important to me. And I'm here, I see myself as a facilitator bringing this all back to you all. But one of the key parts of CHW well-being is really community. And here are some quotes of one CHW saying, "I live in the city that I work. This is my community." So the separation between work and home, or work and community, is really not. And then another quote that I really love, and is actually the title of my, you know, dissertation research, is, you know, this CHW saying, "It may not be rainbows and sunshine every day, but I know I made a difference. It can be stressful, but I love what I do. And I may not always get the recognition, but I know that I do a lot." And I think, you know, if you feel that way often, I think this means that there's something about how you orient yourself to your work that's more than a job, so that when things get too stressful and where burnout starts to happen, we have to think of different strategies to address it. Next slide. Another interesting, again, elevating the voices of CHWs I worked with, another really interesting finding that surprised me is CHWs would say, "I actually really love my supervisor and I can speak up. I'll say my opinion. I'm heard, but nothing comes of it." So again, this speaks to, over time, the kind of chronic stress that starts to build up, because CHWs are advocates and you're speaking up, but then feeling like you're not really heard, or that things don't change, can be really disheartening. And then another CHW is talking about, you know, this CHW feels like they're always complaining. It's just me speaking up. And then noticing that other workers are checked out. I do think some people are completely checked out and they're just here for the paycheck. You can tell that she's kind of just shut off and she's going through the motions. It's hard. This is one CHW noticing what's hard about the impact of you know, of stress at work at that particular moment in time. Next slide. And then you just get to, you know, full out burnout, right? This quote, I'm gonna try, it's a little bit long, I'm sorry, but I think it's so important because this particular CHW was talking about when they decide they need to leave their work. And I think we heard about the pay equity as one way to keep CHWs financially healthy, their family healthy, and also so that they can enjoy the work that they do and are able to stay there. So this CHW says, even though you talk, so you speak up, you go to work with stress, maybe you have conflict with the manager, maybe because you're talking, right? You're speaking up. They're putting this pressure or stress on your work. And then you say, the CHW says, no, I'm not going to stay in a poison or toxic place. I need to move on because I need to be in a good mood every morning, not with stress. I'm going to stress my patient because I'm not going to help them when I have stress in this work. And that is really the core of it that I think is really, I just want to highlight and appreciate all the work that you all do as CHWs, is that you take care of the community. And so it's so important to also take care of yourself, and that our teams and our organizations should also be taking care of you too in all the different ways that we're talking about and that we're going to talk about today. So this last quote, this CHW says, I just burnt myself out because I tend to give all of myself to my jobs. I wanted to move on with family and health. After doing that for 19 years, I was ready for a change. And that's just one example of a CHW that's worked for a long time with the same community and then decided it was time to move on. So I'm going to turn it over to Erica next to talk a little bit about the team well-being and the challenges there.
Thank you, Yaminette. So we're going to shift gears a little bit and think about team well-being, CHW team well-being. And I think when we work with teams, I think we tend to invest a lot of time thinking about the strategies, the goals, the program design, the panel sizes, the workflows. I remember when I became a supervisor, had worked as a CHW for a number of years, then became a supervisor and went straight into the mode of thinking all of the things that I wanted to try to help streamline, in the design of our program in terms of panel sizes and referral systems to help improve, the work and the team. And but today I want to invite you, I want to motivate all of us to take a pause from all of the program design sort of mode in terms of leading a CHW team, and think about the role of the workplace culture and the impact of the workplace culture on the team well-being. So the framing for the team well-being that we're going to use today, the framework is really on the workplace culture. And we're gonna think of a definition before we jump to talking about culture, think of a definition, but I wanna ask you, if you can put in the chat, like when you think of a workplace culture, what comes to mind? Because workplace culture, it's very abstract, right? It's like invisible things, programmatic conversations or things that you do as part of your CHW team, can be very concrete. You're going to create procedures and policies and guides, and it's very concrete, measurable. But when we think about the culture, how do we measure it, and what does it mean? And so we can, think about how the culture can impact the well-being of a team. So let me see if anyone feeling psychological safety, teamwork, okay, diversity, awesome. So the next slide, so we actually have a definition. So this is just the idea that the team well-being really starts with the workplace culture. And I borrowed this definition from this report from the Blue Cross Blue Shield Foundation of Minnesota, and a report that they did on workplace culture and impact on well-being. And so they define workplace culture as a set of beliefs and behaviors in the workplace that impacts how employees work together and perform on the job. So on the next slide, we're going to see a quote from this same report from Blue Cross Blue Shield, and there's a link there to the whole report. You can read, look at it later if you'd like. So this quote from the report says, workplace culture has a direct impact on productivity levels, attendance, and job satisfaction. It also affects employees' personal and home lives, including their health. And here's just a quick, sort of visual of their link between what they found in terms of the link between workplace culture and life experience. And so when they asked people to rate how their company culture impacts their work life and home life, employees who work in a positive culture showed significantly higher satisfaction with their job and their home. And I think this, when I was, just reviewing, looking at this report and thinking about a workplace culture, it reminded me of this popular quote that says, culture eats strategy for breakfast. I don't know if anyone is familiar with, with that quote, but it's the idea of, no matter how much we invest time streamlining our strategy and processes and perfecting the workflows and the program design, all of it will fall flat unless our team shares the appropriate culture, a culture that's positive and promotes well-being. So if we go to the next slide, I want to invite us to think about, when we think of workplace culture, before we jump to what are the recommendations, what can we do to improve a culture within the team, to take a moment and think about some of the warning signs of a negative workplace culture, right? And the impacts that it can have on well-being. It's important for us to identify the needs, the pain points, right? Before we can come to solutions. So the first, so as I started my journey as a supervisor, and then later on began to collaborate with other supervisors around the state and work on the CHW statewide conference and, put together or work with others to offer trainings. Some of the common themes that continue to come up are the themes that I decided to list here on this slide. So the first thing that often comes up is this the issue, the warning sign of this idea of a lack of trust within the team. So we tend to think of lack of trust in three levels. So it's important for team leaders to trust their teams. It's important for teams to trust their leaders. And it's important for team members to trust each other. And someone had used this analogy once that I think is interesting, because so they compared this idea of a lack of trust with it's like a virus that spreads and creates an unhealthy atmosphere and really get in the way of collaboration, productivity, right, staff retention. It gets in the way and impacts ultimately program goals or team goals when there's a lack of trust. When team leaders have a trouble trusting their team, sometimes that shows up in the form of micromanagement. Sometimes when team members don't trust their team leaders, it shows up in the way of maybe the team people don't feel comfortable bringing up questions or problems that they're facing as part of a team, the team. So it prevents team members to come to their leaders, right, for solutions if maybe they feel like they're going to be judged or there's a lack of trust there. When there's lack of trust between team members, it tends to get in the way of collaboration. Collaboration is critical for the success of a team. So I just wanted to, make a few comments about the lack of trust. The next, I'm going to keep going. I think I have about 10 minutes for this, but so poor communication is another sign of a problem that can get in the way of well-being and workplace culture. And so within the context of a team, poor communication sometimes it has to do with, let's say, unclear guidance around responsibilities. So staff or team members feeling like they don't really understand what the core responsibilities for the work, or unclear timeline for completion of projects is another sort of common problem that comes up and creates tension and stress. Lack of feedback is another issue. It's important for team members to hear feedback and have feedback on their performance from leaders. And when there's poor communication and a lack of feedback, that can create anxiety, stress, sometimes conflicts. Let's say sometimes when feedback is not shared until the annual review comes up. So poor communication is a common problem when it comes to helping to promote team well-being. And so again, just the issues around confusion, around goals, guidance, and all of that can lead to poor performance. And so on the topic of poor performance, which is another sign of a problem within the workplace culture, is that when CHWs feel like they're not doing a good job, when they feel like their performance they're not exceeding with their performance, it can lead to this sense of this lack of confidence, or maybe anxiety or stress around, feeling, am I at risk for losing my job because I'm not performing well? So it's important for supervisors, managers to think about, creating opportunities to assess performance needs and strengths and needs of CHWs and staff. So continuous assessment of performance, and as a way to identify the needs and help staff grow. Lack of support is another warning sign of workplace culture and an impact on well-being. I think to use an example of what a lack of support can look like within the work of CHWs is, for example, program processes, or let's say documentation strategies. Oftentimes, there are situations when CHWs or the team members who are the ones operationalizing the work on a day-to-day basis, if they feel like maybe the process is not the best or could be improved, and they bring up those, that feedback to supervisors and managers. And if they feel like they're not heard, their feedback is not heard. And because, those are opportunities for supervisors and managers to serve as mediators, right? If there are, if there's feedback around improvement of processes, it's an opportunity for supervisors to provide, I think my time is almost up, but I'm almost done. Become mediators between CHWs and upper management of within teams of organizations, and become their advocates, right? Advocates for change in terms of the structure, the infrastructure for the team. And lastly, one more thing, a couple more things. So lack of opportunities for growth is another common sign. So the lack of opportunities for job-related skills, improving your job-related skills, lack of opportunities for trainings, lack of opportunities for promotion. So this has to do with the sense of confidence. When I feel like I'm learning, I'm growing in terms of my skills as a CHW, it gives me this feeling of confidence and which impacts well-being. So important to think about that. And I'll last one, and I'll stop here and turn it over back to Yaminet, but just want to highlight this this theme of feeling of unfairness, or I'm gonna say a sense of inequity within a team when it comes to having a voice. So this has to do with hierarchical systems, right, within a team. So let's say a CHW feeling like maybe their voice is not as valued as other members of the team can lead to this feeling of, this is unfair. And when in the context of community health work, I think that it's really important for us supervisors, managers to uphold the value and the principle of equity, which is a key value of the CHW profession, in terms of their voice having the same value as anyone else in the team, because each team member has a distinct perspective and experience to bring to the table when it comes to caring for communities. And it's very important for CHWs within the team to feel like so unfairness can get in the way of that team well-being and a sense of like fairness and equity. So I'm gonna come back later with recommendations for sort of team well-being. But before, I'm gonna turn it over to Yaminet to talk about CHW well-being.
Thanks, Erica. And I'm seeing lots of great comments in the chat too. So I appreciate all the engagement. And we'll get a chance to do more discussion and question and answer. So let's talk about strategies, because we're going to frame it in these kind of 3 levels that we've discussed. So next slide, please. And there was a great comment in the chat, so thank you. I'm sorry I can't scroll up and read the person's name, so I apologize, but there was an ask for a definition of self-care. And because we're talking about well-being in these 3 levels, we're thinking about self-care not just as how an individual can take care of themselves, but also how families, communities can promote health. And this is the definition of the World Health Organization too. And the idea is you're promoting health, you're preventing burnout, preventing diseases, helping people to cope. And that's really our kind of frame for how we're thinking about strategies as well. Next slide. So I'm going to talk a little bit about, well, what can individuals do? Now, there's a lot of different things that we can all do. And you all have mentioned some things in the chat. I saw somebody put breathing exercises and music. And again, a lot of us have a lot of individual strategies exactly because this is the work that we do. And so we're constantly advocating, you're advocating for others. And so you're also a little bit more in tune with potentially what you need for your own self-care needs. That might not always be true, because when we have a lot of stress, we kind of, self-care is something that people say, I just don't have time for it. And so it's really a paradigm shift from self-care is something that you do that's kind of separate from your everyday life to something that you are building in to your life and every dimension of your life. So I'm going to talk a little bit about the arc of self-care. So arc, awareness, regulation, and connection. So what happens when you're at work and you're feeling really stressed? Maybe you're feeling overwhelmed. You just get to your desk, or you open your phone or your computer, or you get to a home visit, and you are just, you're just not feeling great. The first thing is just awareness. What is happening? Just notice your reactions. Or maybe you're in a team meeting and somebody says something, and then you have a reaction. The first thing is just noticing and naming it. And believe me, that goes a really, really long way. This is something you could do at home too. If you're making dinner or you're doing the laundry and you're feeling overwhelmed, or maybe your kid needs something, but you're just like, please stop. It's too much. The first thing you're going to do is just notice your reaction. Notice what's coming up. Then you're going to reflect. You're going to say, hey, I'm noticing that I feel angry right now, or I'm noticing that I feel overwhelmed. So that is your body's way, your mind's way, your heart's way of sending you that signal. And here is where we're going to just essentially think about regulation. Regulation is the fancy word for what do you need to do to keep yourself emotionally safe, physically safe? What are the things that you need to do? For everybody, that's different, and you should have a menu of options. We do have a resource book at the end, and that's a great starting point to start to think about these kind of menu of options of what are the things that you need to do to keep yourself emotionally safe, physically safe, etc. I like to envision, I have this vision, I use this with my kids, of a big TV remote, and I just say, hit the pause button. I say, hit it. Take a breather, take a break. You can breathe. Whew, I'm noticing that I'm really upset right now, right? All right. Then emotions come in waves of about 60 to 90 seconds. So you're going to just you're going to notice the feeling, you're going to catch it, and you're going to release it. What else can you do? Prioritize, think about, if you know this week at work is going to be very stressful, then how do we plan ahead so that you have routines, coping strategies ahead of time, because you already know that it's going to be a really hard week for you. And then asking for help, debriefing with a coworker. Some workplaces have employee assistance programs, finding, if you really don't feel like yourself, finding medical treatment, finding a behavioral health provider to help you really try to understand what's going on. Why don't you feel yourself? And how do we get you back to who you are, who you feel you are, and what you're missing. The last part is really about connection. One big way we take care of ourselves and each other is doing things that bring us joy, play, someone just put recharging, unplugging, absolutely. Connecting with others at work for social support, taking a break, at work. If something heavy really happened and you're just like, whoo, this is impacting me, I need like 2 minutes, taking a walk, putting on a funny TikTok. Everybody has their own way of doing versions of this. So it's really important that you kind of think ahead. If you have a sense that your week is going to be particularly stressful, and then being realistic about it. So self-care is also not like you have to do it, because then some of us feel guilty that we didn't do the thing that we thought we would do, right? So it's really about, you know what, I really can't right now, I really can't make a big dinner. Right now it's frozen food or it's microwave leftovers. And that's okay. There's nothing wrong with that. And maybe, I know my kids complain. They'll say, again, nuggets again, Mom. And I'll say, yeah, nuggets again. I love you. And that's just me being realistic and setting healthy boundaries, right? And we can all do that. So I hope that that's helpful when you start thinking about these individual strategies. And I love all the things in the chat. I'm sorry, I can't read all of them, but I'll hand it over to Erica now to talk a little bit about team well-being.
Thank you, Yaminette. How can CHW supervisors and program managers help to promote team well-being? In my experience, when I was going through that, sort of those questions, became a supervisor, and at the time didn't have any experience and didn't have at the time opportunity to go to a training on how to be a successful supervisor, how to support my team. And I started to just basically Google and do my own research and just pay attention to what was going on with the team. And what I realized as I started to think about the common sort of like themes that continue to come up and that we talked about earlier. So let's just recap a little bit. So for example, issues related to trust and communication and performance and support and advocacy and, and equity. What I realized was that all of these are principles, values, core values that are central, have been central to my role as a CHW, central to my professional identity as a CHW. And so it's in my experience, I decided to create this framework of building a positive workplace culture from the context of the CHW core skills and core values. And so what I want to invite you to think about today is when you think of team well-being, positive workplace culture, to go back to basics and think about the CHW core competencies. For example, I don't know if you have in your state the core competencies, things like effective communication, and of course, providing support and health education, and of course, trust. All of these are principles that CHWs are, working on a regular basis as part of their work with the teams. So let's go back through those, reflect on each of these items and think about how they could work in terms of building a culture, a good culture. So for example, the idea of trust. When CHWs build trust with their patients, we know that patients are tend to be more likely to open up, right? Share about the barriers that are getting in the way of accessing care, following through with recommendations. And similarly, when teams trust each other, trust their leaders, and vice versa, they're more likely to share information, problem solve together, think about programmatic issues, and think together about how to creatively grow as a team. So it's the idea of trust is something that CHWs are it's natural, second nature. It makes sense for us to think about how to bring that value to the team. It's possible because it's what they do every day. It's possible. Supervisors and managers, it's possible to do that. It's what they do on a regular basis. The idea of communication and using communication approaches that convey that you care and non-judgmental. Again, having a good communication with patients and a culturally appropriate, right? Communication and communicating with patients in a way that is clear, and you summarize to patients at the end of conversations what the plan is, and you come up with clear steps for how to achieving your plans, and you try to talk in a way, have conversations, communicate in a way that is motivational. Don't CHWs go to motivation? How many motivation interviewing trainings I've had to go to as a CHW? It's a very common training for CHWs, motivational interviewing, how to have those positive conversations with patients. How about we bring those values to the team in the way that we talk with each other, and team leader and team members with each other, so we can adapt, those values to the culture of the team as a way to promote well-being. Good communication can help to reduce confusion around goals, inconsistencies in how, let's say, for example, we need to all document in the same way in the medical record, the team, but there's no clear communication guidance around how to do that. That's going to impact how you then are going to be able to pull data and evaluate your data, because there's no consistency in how you document the work. So a concrete, programmatic sort of thing that you do as part of your evaluation is impacted by right? This value of having a good communication, clear communication with the team. So when you think of performance, for example, in my analogy, in my framework, I think of, let's say as a CHW CHWs on a regular basis are assessing, right? Assessing the needs of patients, trying to understand what are the barriers, what is keeping patients from accessing the services they need, they care, follow through with, care, plan of care. Similarly, for the supervisor, in the context of the team, assessing on a regular basis, what are the needs, around the performance, of this particular staff member? How can I assess the needs, the strengths, and then work together with them to help this staff member, the CHW, to grow and achieve their goals as an employee. And performance, again, contributes to confidence, right? When I feel like I'm doing a good job, right? I'm doing a good job, it leads to, hopefully good feedback, and you get those good, nice comments and thank yous, and all of that leads to this sense of like confidence. Wow, I'm doing a good job, I'm a great, and I know when we come home after a good day, when we feel like we did a good job, that impacts how we go home, right, and feel about ourselves. I go through that. That's my thing. My husband knows when I didn't have a good day, or if I didn't have a good meeting or a good, a good day at work, that impacts the way I come home, and my relationship with my kids. And so, for encouraging, motivating supervisors to do that ongoing assessment with staff members to identify how can I help the staff member improve the performance as a way to, support the well-being of the staff member and the team. Quickly touching on support. So support here, support is central, right, to the CHW role. Every day, all the time, providing support, mediating between the patient and providers, and other, community-based, resources, serving as a mediator, problem solving, improving access processes for patients is at the core of what CHWs are doing on a regular basis, supporting their patients. Similarly, I want to invite, as supervisors, program managers, to think about the concept or the value of being supportive, in the sense of, am I listening to the feedback that I'm hearing from the team, the CHWs, in terms of whatever it is, the documentation, whatever it is. Am I willing to serve as a mediator between CHWs and maybe upper management, and when they bring up a concern about the organization? Am I helping to problem solve and improve processes for my team? That's what CHWs are doing on a regular basis. We can do that as part of a team as well, if we adapt those values and concepts as part of the culture. Professional development opportunities. So again, here in my sort of framework, I think of CHWs constantly providing the health education, the information, the resources that patients need in order to make informed decisions about their health, right? About how to manage their health. And so they're helping patients improve self-efficacy, right? Through learning together about health, management, or any component of their health. And similarly for the team, in terms of the culture, a culture of development, opportunities for improving my skills that I need for my day-to-day job, and opportunities to go to training, right, to learn a new skill. All of these opportunities for learning and growth can impact my confidence, right? My confidence as a staff member, my sense of well-being, and feeling like I'm learning, I'm growing. And when people feel like they're growing, it gives a sense of accomplishment, right? I've accomplished something, I've learned something, I'm growing. And lastly, to close this, finish this slide, I want to go back to this idea of the previous slide. We talked about unfairness, like I don't have a voice, my voice is not valued equally as other members of the team, in thinking of that as, a warning sign of a culture that is not positive, what I want to just motivate or challenge, as supervisors, managers, to think about in terms of equity, right? Upholding a culture of equity. So, I mean, I don't even need to talk about that here, because equity is at the core of everything that CHWs do in terms of, the profession is grounded in, social racial justice work and improving equity for all, community members. And I think that in the context of the team, I think it's building a culture, promoting a culture where each team member, CHWs, feel like their perspectives, their opinions are valued just as other opinions of other team members. And I want to end this with an example of when something that happened to me that was like clearly, I think for me, illustrated this. One of my roles as a CHW or patient navigator at a health center, I was hired as a patient navigator, community health worker, to work on this new project this doctor had created. He had like this IT background. He had like 1 million letters in front of his name, and he had created a platform for him to manage his patients, like his caseload. And then from that idea, or that, his work grew, and then he created this platform for other providers, other doctors to use. And he decided to create a platform within that, that IT, platform for community health workers and navigators. So I was hired by his team to serve as the CHW navigator, to use this new platform and help them improve it as part of my work working with patients and cancer screenings. So this was 10, 11, 12 years ago. I went to work on this project, and I'm Brazilian. I grew up in Brazil, and within this very small town, and the culture there is very hierarchical, where like the doctors at the top of the hierarchy when I grew up. And my experience with this doctor was really helped me to change that sort of background experience with doctors, and their opinions being sort of above mine, and so that top-down mentality. Because what he would do is he would come to my office, sit down with his notebook, and genuinely wanted to learn how was my experience testing his platform. What was my opinion? What could we do to improve the platform? And he would take notes, and he insisted that I didn't call him by doctor, it was first name. And the dynamics within that team and the culture that doctor created, in the sense of, you are going to be using this platform, talking with patients on a regular basis, you're testing this, your perspective is very important. Without you, I can dream up this platform however I want, but I'm not going to use it. So I need you to help me. And that's the culture he created. It was a culture of every team member was equal in terms of what we brought to the table. And I think that that's a model that, because of that, I felt completely committed to, I'm going to make this work. My voice is important and heard. I'm going to make this work. And we had a great work with the team. So I'm gonna stop here, and I'm going to end. Maybe Yaminette, we go on to the next slide, and then I'll go back to a couple of pictures I want to show. But maybe Mongshi, if we can skip the pictures and go to Yaminette, and then I'll go back to the pictures in a little bit. Yeah.
I'm just very quickly going to say, because Erica already spoke a lot about this, and you'll have access to this information. Again, when we think about well-being at the kind of big organizational level, we like to think about, is your work environment supporting your well-being? Is your physical environment supporting your well-being? And is your social environment supporting your well-being? And I hope that you were able to see how both individually, there are things you can do to support yourself in all these three areas. There are things your team can do, your manager can do. And then there are things that we can do, as a community with each other, right? That's really important. So you'll have access to this, and you'll also have access to a set of resources as well.
Thank you. And I just want to quickly touch on, so we have sort of the social environment, like promoting recognition, empathy, a buddy system, right? And debrief process. I just want to show, and sort of thinking of team culture, I just want to highlight the importance of team building activities. I think that I feel like I'm currently in a health system, and it's always so fast paced. There's so many fires to put out and so many crises. It's really hard to stop and reflect and think about culture, think about these invisible things like connection and trust. It's so hard to just pause and work on those things, but they're foundational they have to be foundational to the work. And I want to highlight, I know Mangshi and the individual teams, they're going to send us the toolkit and some resources that include sort of in activities like drawing and coloring. And I want to highlight that. And I want to show you a couple of pictures from activities, recent activities. This was an activity last week. We convened the CHWs from several sites, and we had a full day of just self-care, team building, and no work. We were just going to have food. I'm Brazilian, so like food is big in my culture. We're just gonna have food, and we're just gonna have team building activities. And so we had this collage activity and a coloring activity with the CHWs, and it created this space where there was so much laughter and connection and like a positive energy and vibe in the room. And they hadn't been together in a long time because of they're still working, a lot of them remotely. And this was an incredible day of like things like these are sort of like magazines that I don't use, just brought from my house with my colleague, and didn't really cost anything. Put some music in the background, and we created this activity for a collage where they were asked to create something, a collage that represented themselves, and we used that activity to just learn from each other. And they got so poetic and so excited and emotional, talking about their identities, and it was beautiful. It was such a great energy. So just a couple of pictures. I want to show another activity, the next slide. This is another activity we did back in September at the end of the fiscal year. Everybody's super, let's just pause. We stopped to do painting. And these activities, this was a team painting exercise where one team member would start a painting, just from scratch, blank canvas, and imagine something. And this team member just painted the background pink. And then we, every 10 minutes, they had to pass the painting, to the project to the next team member. And then that next team member had to sort of keep going, right? So this first person created that pink background. And then the next one looked at it and thought, okay, I'm going to do a sun, like a sunset. And then, the next person looked at it and said, I'm going to add a boat. It's very light. I don't know if you can see it. But this was, again, an activity where we did not talk about work, but through this activity, we talked about our aspirations and professional development, sort of goals, and it was a self-care, and, team building activity that was so energizing and good for connection and building trust. And then the next one, and I'll stop there, but the next one is just very, an idea that sort of like, when we think about workplace culture, sometimes small gestures can make someone's day. And this was 2016. I was at the health center still, and one of the CHWs was having a rough day. And I went to get my lunch across the street at the supermarket. And on my way back, there was this small, tiny potted rose plants, $5. And I'm like, I'm just going to bring this to so-and-so. Her name is Yasmin. You can see her name here. And I gave it to her, and it was like, oh, thank you. Like, it was like a pause, like a brain sort of like pausing from that stress. And then 4 years later, you can see the date up there. In 2020, I was already at my desk working a different job. She took this picture and sent it to me with the stack that said, "This helps me stay sane. The plant you gave me is no longer miniature. It's a grown-up, fully established and strong. Have a good day." So she went home and planted it. I didn't even know. And then she's been taking care of it. And, you know, this was just so nice to see, like small, invisible, right, things or gestures can really, you know, help build a positive workplace culture and the team well-being. Thank you so much. I'm going to pause there and turn it over back to Mongshi.
Thank you so much, Erica and Yamanet, for that presentation and your, you know, recommendations. So we would like to move on to our Q&A section as of right now. We have 7 minutes for Q&A, so we have until 1:50. So please either drop your questions in the chat and we'll try to answer as many as we can, or if you want to come off of mute, please raise your hand, use the emoji and raise your hand, come off of mute and ask your questions. So thank you.
And for the presenters, I posted the 3 questions that were posed in the chat. I reposted those there.
So I guess I would say yes. So first of all, I always love being in community with you all, and I am a proud CHW ally, and I'm also a member of NACHWA. But this first question about what is the number of cases a CHW should have, you know, that's always very program specific. But I think because we're talking about self-care and well-being, and remember, when we're talking about how organizations can foster well-being, you want to think about the work environment and work processes. So if you have a caseload of 100 and you're expected to work with 100 of your community members at the same time, then, you know, there's probably no realistic way for that to happen in a healthy way for you. And it's probably not great for the community members that you're working with too. So we just want to be mindful of what is realistic based on what you're working on and what the intervention is. And I think these are conversations that are kind of ongoing in programs, because there is no, you know, set rule, because it really depends on what we do. However, if you have a caseload and you're feeling overwhelmed and you're feeling burnt out, that's something that definitely is worth speaking up about. And problem solving, right? Problem solving with other CHWs and with your supervisor around how do we get the workload to a manageable pace. I hope that's helpful. Any other? The chat's going so fast that I will, you know, for the resources, I will add the World Health Organization definition of self-care, which aligns with, you know, how we've discussed with it today. And there will be a link that you all can scan, and you'll be able to access resources. I'm a licensed, you know, clinical social worker. I'm a behavioral health provider. So if you're in crisis, we'll be sure to add the new 988 line, finding treatment, so that we're covering all the bases there too.
Yes, Sherry, you could go ahead.
Hi, I asked that question about the number of cases, and I only say that because I find the clinic I've been working in is all about the prepare form for the billing. And I just feel that ethically, to assess someone and see that they have needs and then not be able to help them with their needs because you have too many cases or you can't get back to them or follow up is detrimental to the client as well as the CHW profession.
Yeah, I can say a little bit. This is such a great question, Sherry. And I can say something that I learned from, the work that I've done with community health workers is that programs tend to have a lot of ideas of, and health centers. I used to work in a big health system of here are the outcomes, here are the targets that we need to hit, right? Here's the money we're going to save. And sometimes there's this misalignment with how CHWs do their work best and how they shine. And it's long-term, right? It's sometimes you're sitting in somebody's house talking about this person's cat and what this cat means to this person. That's integral to their health. Now, how do you, operationalize that and show that you're saving money down the line, right? There are all these competing demands. And this is a very tough, thing to really solve. I would love to hear from others what you've done in this situation, but I would encourage you to really speak up about, I can't do my best work, and the community will be, harmed if we're asking questions, but then we're not really able to work to help in the way that we really love to help. So, this is tough, and I think it requires a lot of hard conversations. And hopefully there's enough support between here and where you work that, there can be an agreeable solution.
Thank you for that answer. And I would just leave this is a profession and we're organizing, and I think we need to start defining for ourselves what we can successfully do with these grants and funding that the federal government and CMS is offering as a billable code, and get in front of it versus being exploited.
Thank you, Sherry. So we would like to wrap that up. Unfortunately, we're a little bit short on time. And then can I have you go to the next slide, Courtney? Okay, so I would like to thank the presenters and the attendees once again for joining us today. We appreciate you taking your time out of your schedule to be with us. We do look forward to seeing you all in our next webinar, which will be on Thursday, January 25th at noon Pacific time, 1 Mountain Time, 2 Central Time, 3 Eastern Time. And this webinar will be led by our evaluation team. And it's called Introduction to Evaluation Frameworks and the Basics of Logic Models. And then we do have the webinar link provided, and we will also drop that in the chat. So please register for our upcoming webinar for January. And then I will pass it on to Monique.
Okay. Thank you all so much for being with us today. This is great information. And now we will do our poll. And so please participate in our poll. We definitely appreciate all feedback. And so the poll has just popped up on your screen. If you can please do that for us. Also, just making sure the 2109s know that you can add your request into AMP. Please do that. There is an opt-in list served that I dropped in the chat. I can do that again because I see everybody going, so I will definitely do that again. The materials will be sent out as far as a follow-up, everything that went on in the webinar today, that will be sent out as well. And a resource box will be sent out to those who participated in the webinar today. And thank you all so much for your participation in our webinar today.